Northern Health is admitting to an error that may have affected thousands of patients. It says procedure was not entirely followed when conducting certain tests. Officials assure there will not be adverse medical consequences to any of those patients, but wants to come clean on the mistake.
Northern Health took several steps in the interest of patient safety.
No one likes to admit they've made a mistake. That includes Northern Health, but that's exactly what they've done. Northern Health says between 2012 and the end of last year, endoscopes used for certain procedures were not cleaned as per the manufacturer's instructions for the pre-cleaning stage. Since the discovery, Northern Health has been in contact with the BC Centre for Disease Control.
The conversations with BC's Centre for Disease Control, who are the experts in the potential transmission of infectious diseases in the province, indicate that the likelihood of transmitting any infectious disease, any communicable disease in this case, is exceptionally low. It's so low they can't even put a number to it, so they can't say that it's 1 in a million or 1 in 5 million.
In fact, the BC CDC even questioned whether there was a need to go to the public, but Northern Health did.
If there is a problem and it affects our patients, it's important that patients need to know that, so that they are aware of that. And that we just believe is the right thing to do as an organisation that's committed towards quality.
Northern Health will be sending out letters to all 10,000 patients who have had an endoscopic procedure. And while there is no need to worry about infection, Northern Health realizes patients will be concerned.
If they've had a procedure during the affected time period, they will get a letter. But if they haven't had their letter yet and they're concerned and they think they've had a procedure, contact their physician, their family physician who referred them to the specialist, and that family physician can provide them with advice. Centre for Disease Control is saying that nothing needs to happen. They don't need to be tested.
We pride ourselves on providing exceptional care. It's part of
An audit has been conducted of the equipment in question and the error has been corrected. But that isn't the end of it.
What we've done in terms of work is to put together a working group around how do we stay current with all the changes. As you bring in a new scope, how do we ensure that we follow manufacturers' guidelines every single time for every piece of equipment?
To date, there have been no formal complaints leveled against Northern Health with respect to this matter. Cheryl Jan, CKPG News.